Great. Well, thank you all so much for joining us tonight. Tonight's program is entitled Managing Memory, Alzheimer's, and Dementia with Dr. Andrew Budson. We're joined tonight by Dr. Andrew Budson for his presentation on two of his books, 7 Steps to Managing Your Memory, What's Normal, What's Not, and What to Do About It. And his newest book, 6 Steps to Managing Alzheimer's Disease and Dementia, A Guide for Families. We're going to learn how individuals can distinguish changes in memory due to Alzheimer's versus normal aging, what medications, diets, and exercise regimens can help, and the best habits, strategies, and memory aids to use in 7 simple steps. And we're also going to discover how families can manage a loved one's issues with memory, language, vision, behavior, driving, incontinence, sleep, and more. And Dr. Budson, I think Dr. Budson has like the most impressive resume of any speaker I've ever introduced. He's the Chief of Cognitive and Behavioral Neurology at the Veterans Affairs Boston Healthcare System. He's the Director of Education at the Boston University Alzheimer's Disease Center. He's a Professor of Neurology at Boston University School of Medicine, and he's a lecturer in neurology at Harvard Medical School. I was doing so well until the end there. Neurology at Harvard Medical School, among other things. That's I'm cutting his bio short a bit. So again, want to thank the Corning Foundation, and let's all please give a big virtual round of applause to Dr. Budson for joining us here tonight. And Dr. Budson, the floor is yours. Thanks so much.
Yes, thank you so much, Robert. It's a pleasure to be back here and speaking to your library and some neighboring libraries. It's nice that others can join us. And, you know, I wanted to actually start by asking whether some of you have heard me talk before. And we're going to be using the chat function tonight. And so I would love it if you just give a Y or an N, or you can type out yes and no, but a Y and N are fine, about whether or not you've heard me talk before. Just wanted to get a sense, just so I can see. Okay, so it looks like a few people have heard me talk before, but most people haven't. Okay, so that's good. So we're going to do a balance. For those who have heard me before, we're going to do a balance of some things you may have heard before, but at least half of it should be brand new. So I think we're going to have a lot of fun tonight. And yeah, no, it's a serious topic we're going to talk about, but we're still going to try and have some fun. We are going to dive into this right now. And I'm going to do some talking just based on like I'm doing now, and I'll be doing a little bit of reading from my books, and we'll show some slides as well. So we're just going to dive right in here. I'm going to share my first slide here. This just has my titles, and we're going to be talking about both of these books tonight. And we're going to start with the 7 Steps to Managing Your Memory book. And just to emphasize that both of the libraries, all the libraries do have copies of this book. So you don't need to purchase it. You can just check it out of the library. And Robert will be giving you information. If you do want to get your own copy, you can, of course, do that as well. But I'm a big fan of our local libraries. So we're going to begin by talking about the 7 steps to managing your memory. And we are going to begin by my reading a little bit from the preface of the book to get a sense as to what you already know about memory. And I'm going to read some different scenarios. And as I read each of the scenarios, what I would love for you to do is to type into the chat a yes or no. Again, a Y or N is fine, about whether each of these scenarios is normal, just what happens as you get a little bit older, it's what happens to your memory. Or type an N if you say, wait a minute, this is not normal. Okay, and this could be the start of Alzheimer's or dementia. So here's the first scenario. So you walk into a room to get something and you forget why you're there. What do you think? Is that normal or not normal? So I want to see lots of Y's on the chat. That one is normal. Whew, thank God, right? If that one wasn't normal, we would all be in trouble. Yes, thank you all. You're very fast at hitting those Y's. Here's another scenario. What about this one? You're having trouble remembering some of the details of your life, such as your wedding. Is that normal or not normal? What do you think? Getting a mixed picture on that one. How about this one? When you are driving and not paying attention, you take one or more wrong turns and you end up somewhere you did not intend to be. What do you think? Is that normal or not normal? Another split decision on that one. How about this one here? You're having difficulty finding your car in a parking lot. Is that normal or not? Most people are like, that one better be normal, right? And my all-time favorite, what about this one? Your family tells you you've asked that question before. So it is my job this evening to empower you all with the knowledge as to whether each of those things are normal, whether they're not, and most importantly, what to do about them. I also hope that the knowledge I give you tonight will allow you to figure out whether things that you have noticed that you're having trouble with or a loved one's having trouble with, whether they're normal and whether they're not. And we are going to accomplish this by diving in now to the 7 steps to managing your memory. And we are going to begin with step 1, which is learn what is normal memory. And we're going to begin with a filing system analogy. So let's say that you want to remember something important like somebody's name. Well, the first part of our filing system analogy I want to introduce you to is our file clerk. The file clerk is actually a part of your brain. It's your frontal lobes right behind your forehead. And it's the frontal lobe file clerk's job to be able to take that information from the outside world and to put it into the file cabinet. When we want to retrieve a memory, the frontal lobe file clerk looks in the file cabinet, finds the memory we're looking for, pulls it out, and is able to retrieve it. So that's what happens in normal memory. But guess what? As we all get older, our frontal lobe file clerk is getting older too. And I'm going to give you an analogy as to what happens to our older frontal lobe file clerk. Well, one thing that happens is she does not hear quite as well as she used to. What? And because of that, information may need to be repeated a couple of times in order for the file clerk to get a hold of it and then to put it into the file cabinet. Now, another thing that happens to our older frontal lobe file clerk is she does not move quite as quickly as she used to. And because of that, it may take us longer to walk over to the file cabinet and to retrieve the information that we are looking for. The third thing that happens to our older frontal lobe file clerk is she does not see quite as well as she used to. And so you can imagine that as she's peering at the file cabinet, looking up and down, she may need a hint or a cue in order to find the information that she is looking for. But importantly, as part of normal aging, as long as the information made it into the file cabinet, it should be able to be retrieved, even if it takes a little bit of time, or a hint or a cue. So in a nutshell, those are the changes in memory that occur as part of normal aging. Now, step 2 is determine if your memory is normal. And we're going to continue with our filing system analogy, but we're going to talk about the changes that occur in Alzheimer's disease. And we're going to now focus on another part of the filing system. We're going to focus on the file cabinet, which is the hippocampus. So the hippocampus is deep in your temporal lobe. So if you put your fingers on your temples, it's deep in there. And the problem in Alzheimer's is that Alzheimer's damages and ultimately destroys the hippocampus. And the way I think about it, it's as if there's a big hole in the file cabinet. Now, if there's a hole in the file cabinet, you can have the best, most efficient file clerk in the world pulling in information from the outside world, putting it into the file cabinet. But what's going to happen? It's going to disappear into the hole, never to be retrieved again. And when that happens, even when information is repeated, even if you wait a bit of time or give a hint or a cue, it cannot be retrieved. And when that happens, we call it rapid forgetting. And rapid forgetting is never normal. It should always be evaluated. So let's talk now about some of the other problems that happen in Alzheimer's disease. And the first one I want to talk about is getting lost. Now, anybody of any age can get lost. You make a wrong turn, something doesn't look familiar, bam, you're lost. But what do we all normally do? Well, you can pull out maybe a paper map from your glove compartment, or this day and age, probably more likely a map from your phone. You can use a GPS, or you can pull over and ask for directions. And using any of those methods, you're back on your way. But in Alzheimer's, it's more difficult. Paper maps and phone apps and GPS devices can be complicated and confusing to use. You can pull over and ask for directions, but they're often long and detailed and hard to remember. And it's for those reasons that people with Alzheimer's have such difficulty getting lost. Let's talk about another common problem in Alzheimer's, which is losing things, misplacing things. But guess what? Misplacing things is often pretty common. I want you to type in a Y in the chat if over the past year you have misplaced your keys, glasses, wallet, pocketbook, cell phone. Has that happened to anybody? Yeah, me too. So if you are misplacing things, how do you know if it's normal or not? Well, listen, if you are someone who every morning, all your life, you spend 5, 10, 15 minutes, hunting around the house, trying to find where you put things, and now you're getting a little older, and you're still spending 5, 10, 15 minutes hunting around the house trying to find things. Well, guess what? That's probably normal for you and not something to worry about. But if you were somebody who was always very organized, always knew exactly where everything is, and now all of a sudden it's taking you not only 5, 10, 15 minutes, but 20 minutes or an hour hunting around the house trying to find things. Maybe you have to buy a new cell phone because it never did turn up. Maybe you had to cancel the credit cards because you never could find that wallet. Well, that could be a problem. So the point I'm trying to make here is it's not only what the problem is, but it's also whether it represents a change from the way things used to be. Okay. Let's talk about the last thing that I'm going to in this section, which is about repeating questions and stories. Now, anybody can be halfway through telling a story to a good friend and you say, oh my God, I told you this already, didn't I? And anybody can forget the answer to a question and ask it again. But when there is a pattern of repeatedly asking the same question to the same person again and again and again, or telling the same story to the same people over and over and over again, that is not normal. That is usually due to that rapid forgetting that we were talking about, because the individual rapidly forgets that they have already asked that question or told that story. Okay, well, let's continue with our slides here. So we just covered these things, and we're now going to move to step 3, which is understand your memory loss. And we're going to talk about the most common question that I get asked, which is, what's the difference between dementia and Alzheimer's? Okay, so dementia simply means that thinking and memory have deteriorated to the point that it interferes with day-to-day function. And Alzheimer's disease is one type or one cause of dementia, okay? Alzheimer's has a specific pathology, a specific stuff that is in the brain that's not supposed to be there, that's causing trouble and causing death of brain cells. And there's a lot of other causes of dementia too. There's vascular dementia, which is dementia due to strokes. There's Lewy body dementia, which is like Parkinson's disease dementia. There's frontotemporal dementia that affects behavior. And there's lots of other types as well. So dementia is the general category, and Alzheimer's is one specific type. Let's talk about another term, which is mild cognitive impairment. If you've heard of this term, mild cognitive impairment, type a yes or a Y into the chat. So mild cognitive impairment is present when there's 3 things. The first is that someone is concerned about the memory. The second is that when the person undergoes pencil and paper testing, yes, indeed, a problem is found. But the third thing is that their day-to-day function is fine. If their day-to-day function is fine, then by definition, they do not have dementia. Now, what the studies show is if you follow people over time with this mild cognitive impairment, about half of them do end up declining and developing either Alzheimer's disease or another cause of dementia. But that also means the other half don't. The other half stay stable, or they actually improve over time. You might say, how does anybody's memory improve over time? Well, if the memory problems were due to depression, low mood, if their mood gets better and it lifts, their memory can get better. Another common cause of memory problems are medication side effects. And I think this was a question that's already come up in the Q&A. And the answer is, if the problem with the person's memory was due to medication side effects, if they work with their doctor and they adjust their medications, their memory can improve. Okay, we're now going to move over to step 4, treat your memory loss. And we're going to talk about both some of the standard treatments and also that new Biogen treatment that's recently come out. And before we talk about the specific treatments, I need to tell you how Alzheimer's impairs brain function. So we believe it starts with an accumulation of this protein called amyloid. Now, the amyloid clusters and clumps together to form these plaques. And the plaques get bigger and bigger, and it starts to damage brain cells. Then inside the brain cells, a protein called tau gets loose, and the tau is very sticky, and it forms these long chains that get all tangled up. Once the tangles form inside the cells, it kills the brain cells. And the cells are normally making chemicals, neurotransmitters, that allow different parts of the brain to talk to one another. And one of these most important chemicals is called acetylcholine. So in Alzheimer's disease, levels of acetylcholine drop. It's for this reason that the mainstay of therapy that can help improve memory are the cholinesterase inhibitors, the medications that stop the breakdown of acetylcholine. These are medications that I bet most of you have heard of. Some of you may be taking these medications. These are medications like donepezil, brand name is Aricept, rivastigmine, whose brand name is Exelon, and galantamine. All of these medications help to raise up the levels of acetylcholine in the brain. Now, from the perspective of the individual and their families, what these medications can do is they can turn the clock back on memory problems by 6 to 12 months. So what I mean by that is when somebody comes in to see me for memory problems and I prescribe for them one of these medications, I can make their memory like it was 6 months ago, or maybe even a full year ago. And the earlier they come to see me, the more likely it is that I'm able to turn that clock back a full year. And the reason why is that there are more brain cells that are still living that the medication can work on. Okay? Now, I talked about turning the clock back, but unfortunately, I cannot stop the clock from ticking down, okay? But the person's always going to be better off to be on the medication than not on the medication. And if they accidentally stop the medicine, what happens is they can plummet 6 to 12 months worth of memory function in 1 to 2 weeks, sort of back to where they were if they weren't taking it. So as long as the person had a good initial reaction to this medicine, even if they're declining, I still want them to take the medication. Now, we talked about not being able to stop this ticking clock, but can we slow it down? Well, this is what this new drug, aducanumab, is trying to do. So, this medication, as many of you may have heard, was FDA approved on June 7th, 2021. So it is a monoclonal antibody. Now, antibodies are normally what your body uses to fight off infections like bacteria and viruses. And in fact, all of you who have had the COVID vaccine, you were given a vaccine to help your body make antibodies against the COVID virus. But aducanumab is an antibody that is made in a laboratory that's given to you by vein, by intravenous injection once a month. The idea is that aducanumab will stick to those amyloid plaques that causes Alzheimer's disease. So what happened in this trial is that the company Biogen, they did 2 large trial that had over 1,000 patients in it. And when they put the data together and they looked at it in March of 2019, they said, you know what? This stuff doesn't work. We're pulling the plug on the trial and we're done with it. But then in October of 2019, they analyzed both trials separately and they said, you know what? It looks like one of the trials was actually positive. And they sort of said, yeah, and the other one was probably negative. But one was positive. Let's go to the FDA, see if they'll approve it. So here's the actual data. And I apologize that this is a busy slide, but I wanted to show you the actual data. So this is baseline, okay? Anything where these dots are around the baseline means the drug didn't work. And we're going to focus on these blue and green circles. Now, the ones that are right around this baseline saying it didn't work, these are the low dose. So if you were in the blue trial or the green trial and you were on the low dose, didn't really do anything. Now, if you're up top, this favors placebo. It means the people in the placebo group did better than the people who actually got the drug. If you're below the red line, this favors treatment. This means that the people who got the real drug showed a benefit over the people who got the placebo. So what they found in the green trial is that if you were in the high dose, it was good. Okay, you're below the line, that's good. So it seemed like it was working. But if you were in the blue trial, you got worse. And in fact, the amount you got worse in the blue trial was almost exactly the same as the amount you got better if you were in the green trial. So one's positive, one's negative. So the effects were actually quite small. They were equivalent to turning the clock back 3 months. So they're somewhere between 1/2 and 1/4 as powerful as the donepezil or Aricept effects. And there also were side effects in this trial. 30% of people had brain swelling. And what you're looking here, the white areas are areas where there is brain swelling, okay? And this brain swelling can lead to permanent strokes. There also was brain bleeding in 10% of people. So we don't know if this drug works or not. You have to have either an amyloid PET scan or a lumbar puncture first to make sure you have Alzheimer's. You need to be on a monthly infusion forever. It costs $56,000 a year. It's currently not covered by Medicare or other insurance. You have to be monitored for the side effects of brain swelling or brain bleeding with lots of MRI scans. I basically think there's no certain benefit, but there is 40% chance of certain side effects. So I don't recommend it. I think if people want to do more than drugs like donepezil and Aricept, I recommend participating in a clinical trial of a new drug that may actually work better, or it might not, but that would be my advice. Okay, there's some other things out there that also don't work. Prevagen, curcumin, ginkgo biloba, resveratrol, none of these things show any evidence of benefit. Okay, let's take a look at step 5, which is modify your lifestyle. And it turns out that a Mediterranean menu of foods has been shown to be beneficial. These are the things that are good to eat. They include fish, olive oil, avocados, fruits and vegetables, nuts and beans, whole grains, and from the MIND diet, poultry like chicken and other fowl. So those are the things that are good to eat. So what are the things that are not good to eat? Well, I hate to tell you, it's almost everything else. So red meats, fried foods, fast foods, butter and margarine, pastries and sweet, white bread, white flour, white rice, sugar sodas, diet sodas, fruit juices, all of those things I would put in the category of once in a while foods, not everyday foods. Now, before everybody gets really depressed and thinks, oh my God, I can never have dessert again, I did want to remind you that chocolate in small amounts has been shown to benefit thinking and memory and mood. You just have to remember that it's what type of chocolate? That's right. I can hear you through the Zoom. It's dark chocolate. The darker, the better, because it's the cocoa that's good for you, not so much the butter and sugar and milk that they put into it to make it sweet and creamy. So that's a little bit about food. What about exercise? Well, exercise, as you know, is good for you. And I bet you that even though everyone knows that I can tell you at least one new thing you did not know this evening about just how good exercise is for you and why. But if I inspire you tonight, before you lace up your jogging shoes and run out the door, I do want you to check with your doctor and just make sure that your heart and your lungs and your bones and your joints are ready for whatever increased exercise you were going to do. Having said that, there's lots of different types of exercise that you can do out there. Many of the studies just use brisk walking. So that's a wonderful exercise in and of itself. Now, the recommended amounts are 30 minutes a day, 5 days a week of aerobic exercise. Now, what's aerobic? Aerobic is exercise that gets your heart beating quickly, gets you breathing heavily. That's how you know it's aerobic. Also recommended are 2 hours a week of exercise that helps with strength and balance and flexibility. So these are things like yoga, Tai Chi, Pilates, and isometric weight training. Exercise reduces the risk of strokes, which can impair your memory, reduces falls, which if you fall and hit your head can obviously hurt your memory. It is actually a natural antidepressant, better than many antidepressants that are prescribed today. Exercise also improves sleep. Some of you might say, well, that's good, but what does sleep have to do with memory? Turns out sleep has a lot to do with memory. I'll tell you just some of the things. The first is that if you don't get a good night's rest, you're going to be tired the next day. And if you're tired, it's hard to pay attention. And if you don't pay attention, you're not going to be able to remember things. The second thing is we all make some of this beta amyloid protein while we are awake, but we normally clear it out of our brain while we are sleeping. So we need to get a good night's rest to clear out the amyloid protein. The third reason is we need good sleep to hold on to our memories for a lifetime. We talked about the hippocampus as the place in the brain where all the new memories are formed. Turns out there's another file cabinet where all the older memories are in the brain. And this transfer process from this new memory file cabinet to the older memory file cabinet happens when we sleep. So we need sleep in order for this process to go on. But the most exciting thing that I want to tell you about exercise is that exercise releases growth factors in the brain that actually helps you to grow new brain cells. And guess where there's more brain cells than anywhere else? That's right, you guessed it, in the hippocampus. And this increase is so large that you can see it on an MRI scan in as little as 6 months. People sometimes say, Dr. Budson, isn't there some magic bullet out there that can really help improve my memory? I answer, yes, there is. It's exercise. Exercise truly is the magic bullet. Now we're going to talk about strengthening your memory. And it turns out that there are some good general approaches. So, social activities, and I know it's hard to do in a pandemic, but they have been shown in study after study to be beneficial. And I think it's because that's really what our brains evolved to do, is to have social interactions. Also, if you want to do something with your brain, it should be new, novel, stimulating activities, okay? Not the same old thing you always do, but something new, something different. The third thing that's important is keeping a positive mental attitude. And it sounds like pop psychology, but it's been studied and it's really important. And we think it's important for all the obvious reasons. People with a positive attitude are more likely to take care of themselves and eat right and exercise. People with a positive attitude are more likely to be social and outgoing. Now, what about those brain training games or doing crossword puzzles or Sudoku? Will that help you? Well, it's been studied. And if you do brain training games or crossword puzzles or Sudoku, you get better at brain training games, crossword puzzles, and Sudoku. It simply does not translate to overall brain function. But I'm certain it's better than TV, no doubt about that. Okay, there's also a whole bunch of different strategies that you can use, and I don't have time to go through them all, but you can use mindfulness to improve your attention. You can learn how to remember people's names better, keep your grocery lists in your head, keep your passwords in your head. There's a lot of different strategies you can use. We are also a big believer, my co-author and I, in using memory aids, things like tables where you put down your cell phone and your wallet and your pocketbook so you know where they are, pillboxes, calendars, notebooks, to-do lists, phone apps. Use memory aids. The last part of the 7 Steps book is about what do you do if you're having mild memory problems? How do you still keep doing all the things you enjoy doing in life? How do you keep working if you're working? How do you keep doing your hobbies? How do you keep driving? And how do you know if you're doing these things safely? We also talk about how do you know when is it time to retire from that job? How do you know when it's time to hang up the keys and let someone else do the driving? So those are the 7 steps to managing your memory. And now we're going to pivot and talk about the 6 steps to managing Alzheimer's disease and dementia. Okay, so we are going to start by talking now to our caregivers out there. And I'm again going to read from the preface, and I'm going to read some quotes from things that family members have told me and my co-author. So if any of these resonate with you, please type a Y into the chat if you're a caregiver or know someone who is. I always thought I'd have a lot of patience, but if he asked me what we are doing today one more time, I think I will scream. He wants to drive, but I don't know if it's safe. It's happening every evening now. She keeps saying that she needs to go home, but we're already home. Yesterday, I found a pan burning on the stove, so now I can't leave her alone anymore. When I came home from the hairdresser, he asked me who I was. He really didn't recognize me. Well, I don't know if those sound familiar to any of you out there, but these are real important problems that can happen when one is caring for someone with dementia. So we're going to talk a little bit about some of the strategies that we have in the book that can be helpful. And I will freely admit that we're just going to sort of scratch the surface here because it's a very rich and important topic. Step 1 is to understand dementia and to talk about those issues that we talked about before. What's the difference between Alzheimer's, dementia? What's vascular dementia? What are the other types of dementias? And how do you make sure you have a proper diagnosis? That's step 1 that we really already covered. Step 2 is how to manage all sorts of problems without the use of medications. And we begin by talking about how to approach problems in dementia. Then we talk about all sorts of specific problems that can be managed. And we're going to talk about 3 of these general strategies. The first strategy is what we call the 4 R's. Okay? If our loved one is agitated and upset, let's say they're trying to leave the house to go, quote unquote, home, even though they're already home. Well, we want to use the 4 R's. The first R is reassure. We want to reassure our loved one that everything is okay. We want to reconsider things from their point of view. they don't feel like they're home. They're thinking of their home where they grew up, perhaps. So reconsider things from their point of view. It helps us understand why they're behaving the way they are. We want to work on redirecting them to an activity that distracts them from the activity you're trying to get them away from, the behavior you're trying to get them away from, and to something else that's calming and more functional. And the fourth R is relax. Take in a deep breath. And that's something that we all need to do as caregivers, because if we're irritated or frustrated or angry, we can inadvertently reflect those emotions back to our loved ones and escalate the situation. Another good strategy is what we call start with small steps. So let's say it's bath time. Dad, time to take your bath. I don't want to take a bath. I took a bath last month. No, Dad, I'm sorry. Once a month bath is not enough. Come on, time to take a bath. I don't want to take a bath. Well, sometimes you can start with small steps to help get at this sort of stubbornness or willfulness. Say, Dad, you have a little bit of dirt on your nose. Let me just get a washcloth. I'll just wipe this dirt off your nose. And look, you got a little bit on your cheek too. Here, I can get rid of that. And you got a little bit on your neck, and I'll get rid of that. And oh, look, I got your shirt wet. Maybe we'll just take it off so I don't get your shirt wet. And then you keep going like that, little by little. Next thing you know, Dad's in the tub. Now, sometimes these simple approaches don't work, and you have to use a more sort of reasoned, logical, thoughtful approach, which we call the ABCs. The antecedents, behaviors, and consequences. So we want to pay attention to what came before the behavior, okay? We want to look at the behavior itself, and we want to look at the consequence, what happened. So again, maybe it's bath time, and the behavior was Dad was yelling for 7 minutes, okay? They didn't want to take a bath. And what was the consequence? Let's say we said, all right, forget it. No bath today, you win. What did we just do? We inadvertently reinforced the behavior. So at an unconscious level, Dad has learned if he just yells and screams, he'll get his way and he won't have to do what someone's asking him to do. So the ABCs can help us see patterns like this that we can use to help with behaviors. Okay. So let's talk now, instead of general approaches to manage memory problems. And there's all sorts of different things that we can use. One of the important ones is to unplug the stove or take the knobs off the stove so that people don't forget and leave the stove on. We want to make a plan for wandering. We talked about the individual who was trying to leave the house to go home. Someone like that, make a plan for wandering right away. Don't wait till they've left the house to figure out how you're going to get them back. If someone has a false memory, they say they were talking with their parents, even though their parents have been dead for 40 years, don't fight it. Go with it. Say, oh, that's wonderful. You had a nice chat with your parents. And distract them, use the 4 R's, redirect them to something more reality-based. And lastly, in terms of memory problems, sometimes it's hard to remember that you keep forgetting things. So lots of people with dementia don't remember they have memory problems, and reminding them is rarely a helpful thing. Language problems are very common in dementia. People have trouble finding words. They have trouble understanding words. You want to check their hearing, make sure that's not the problem. But don't forget, you can use pictures to communicate, and also that nonverbal and emotional communications are often preserved. So the tone of voice that you use, gesture, touch, body language, all of those things are going to be preserved. What about vision problems? Well, many people have trouble recognizing their family. Sometimes it's because they have trouble remembering what they look like. Sometimes it's because the occipital cortex in the brain, the part that's in charge of vision, isn't working well. Sometimes they even think you're an imposter. They think you've been replaced by somebody else. We talk about strategies that you might be able to use, non-visual cues like us talking to them on a cell phone that might solve such a problem. You certainly want to check their vision and their glasses, and you can also increase lighting and contrast. And we talk about how to reduce the impact of hallucinations, even if you can't eliminate them entirely. It's always important to treat anxiety and depression and to distinguish it from its lookalikes, such as pseudobulbar affect. We talk about managing behavior problems. How do you deal with driving? How do you know if it's safe to drive? We talk about how do you deal with that. The short answer is you want to have a family member ride in the passenger seat of the car when the individual is driving, whatever routes they normally go. If the family member is happy, then I'm happy. If the family member is not happy, then I say no driving. Simple as that. Talk about conquering apathy with routines, and there's lots of other things that you can do to manage behavioral problems. It's always good to look for a medical problem like an infection in the urine. You want to stay safe, give away guns and power tools. You want to plan around sundown. So many individuals with dementia are worse in the late afternoons, early evening. So the simple advice is don't try and do anything adventurous at that time, right? That's maybe a better quiet time at home. Don't argue with jealousy and paranoia. You're not going to logic your way out of it. Use the 4 R's. Reassure them, reconsider things from their point of view, redirect them, and relax. Don't forget that music can be very soothing and can help to calm them down, as can real pets, robot pets, and even stuffed animals. Sleep problems are super common in dementia. I had a patient that was in my office this afternoon, okay? And the problem that I heard is she goes to bed at 9 o'clock. That's the time she and her husband go to bed. And she wakes up at 5 a.m. and is keeping everybody up. And they wanted me to give her a sleeping pill to keep her asleep, okay? But if you add up the hours that she is in bed from 9 p.m. to 5 a.m., that is 8 hours. She's just slept all she needs to sleep. She slept 8 hours. I say, well, if you want her to wake up at 6 or 7, she's got to go to bed at 10 or 11. It's as simple as that. Just because somebody has Alzheimer's doesn't mean they suddenly need more sleep. Some do, but not everybody. Many people still need 8 hours, 7 hours, 6.5 hours, whatever amount of sleep they usually have. We talk about a lot of strategies to improve habits. You want to look out for medical disorders that can cause sleep problems. A little bit of melatonin can sometimes be helpful. There's all sorts of bodily function problems that can happen. And one of the most serious are falls. People can fall, they can hit their head, they can break a hip, and there's all sorts of different things that one can do to reduce the risks of having falls. We also talk about how to reduce incontinence. During the day, the easiest thing to do is use a toileting schedule. So if they're having accidents every 2 hours, there's a solution for this. You have them go to the bathroom every hour and a half, try and urinate, whether they feel like they need to or not. Usually eliminates daytime incontinence, and we have other strategies for nighttime incontinence. You can use heavy silverware and heavy mugs to dampen down tremors. This can be very successful. Okay, step 3 is asking about medications. And it's very important to track your medicines. And I will tell you something that I'm very pleased that Oxford University Press let me put into this book, is that we have all sorts of lists of medications that I was able to put in, just list after list of all sorts of medicines that can cause problems. So here I have the classes But not only are the classes in the book, but the individual medicines are as well. So if you're worried that it's a medication that's causing your memory problems or your loved one's memory problems, you can look through the list and see if any of them are on it. I do want to caution you, however, you can't just stop the medicine because it's on the list. You need to speak to your doctor about it. See if there's another medicine that could be substituted, or you can get away with a lower dose. Okay. Note that alcohol impairs everybody's memory. Okay, you have a glass of wine, I don't care how old you are, it's going to impair your memory. But one alcoholic beverage a day is certainly not going to cause any permanent damage. But more than one alcoholic beverage a day for an older adult could. Okay, so I want people to consider non-alcoholic beers and wine, especially if you like to have more than one in an evening. When you're going to try a new medicine to help, it's important that you track it, you try and quantify it to see how it helps. And we have strategies to help improve thinking and memory with medications. The first strategy is to help improve cognition, because of course, they didn't have the behavioral problems when their memory was normal. So we want to try and improve thinking and memory using medicines like we talked about, like the donepezil, the Aricept. We want to help them feel more calm. And there's medicines in the Prozac family of drugs, such as sertraline or escitalopram, brand name Zoloft and Lexapro, that can help with that. And lastly, if we can't do anything else, we help to suppress some behaviors using a little bit more powerful medications. We talk about building your care team, and we start with you if you're a caregiver, the most important member of the care team. My co-author, Dr. Maureen O'Connor, has this great phrase, which is you can't pour from an empty cup. So she talks about how it's so important to care for yourself and fill up your own cup. You want to take care of your physical health, you want to exercise, you want to eat right, you want to take care of your own doctor's visits, you want to maintain your social connections, see your friends, do things for yourself. All these things are really important. We also talk about how to engage families, friends, neighbors to help. What are the different tasks they can do? How can they share the work? Because no one person can take care of someone who has dementia all by themselves. It really is a team sport. You need help. Don't forget about support groups. They can be very valuable. You can have professional caregivers, get respite care, day programs. The Alzheimer's Association is a good resource, and hopefully your doctor will be a good resource as well. Step 5 is sustain your relationship. And we talk about the fact that relationships change when someone has dementia. There's changing abilities and interests, and it's important for you as the caregiver to take the lead, plan ahead, start with something small, but keep trying and hopefully be successful with activities that you and your loved one can enjoy, even though they now have dementia. Okay. There's a lot of different activities that you can do. And you can imagine them, go to museums, performing arts, sit at home, listen to music, do arts and crafts. Arts and crafts are fun. Exercise together, enjoy nature together, all sorts of different things that people can do. The last step of our 6 steps to managing Alzheimer's disease and dementia is plan for the future. And here we talk about these things that are often difficult for everyone, but particularly for families. We want you to plan early, involve your loved one in the planning if possible. Think about medical and legal issues, think about financial issues. Be aware that your loved one can easily fall victims to scams, con artists, just having poor judgment. So try and protect them. You don't let them lose thousands and thousands of dollars. Put limits on the credit cards, bank accounts, things like that. So they're not going to lose their life savings because someone conned them or scammed them. We talk about when is it time to make a transition to another type of living situation, and how do you ease into that situation so it's not traumatic, or it's at least as least traumatic as possible. We talk about things that are difficult to talk about, like, what would the ceremony be like at the end of their life, at the funeral? What is the death itself going to be like? How do you know if death is near or not? We talk about what does it mean to be dying from dementia. Talk about what do you do with the body? And importantly, how do you plan for your own future, right? For caregivers who have devoted themselves for several years to caring for their loved one, and they've stopped working, they may have stopped seeing their friends despite, everyone's best intentions. What do they do afterwards? How do you get beyond it? So those are the 2 books, the 7 steps to managing your memory and the 6 steps to managing Alzheimer's disease and dementia. I do want to encourage you to check the books out of the local library, but of course, if you want a copy for yourself, you can get them from the usual places. And in addition to the books, I do have some blogs. I have a Psychology Today blog and a Harvard Health blog. You can check those out. I have a website, and I don't mind if people email me directly. You can see my email there. You can also follow me on Twitter and Facebook. So that ends the formal portion of my talk. And I want to invite all of you to type questions into the Q&A. And I'm going to begin to answer the questions now that are in the Q&A. And so, so the first question I think I've already answered, which is, can medications cause you to forget things? And the answer is yes. And what are the types of medicines that can do it? It's a very long list. Some of the most common things that cause memory problems are older antihistamines like Benadryl, and sleeping pills other than melatonin. So Zolpidem, Ambien, and other sleeping pills like that tend to cause memory problems, but there's a lot of other things. Next question is, do you think that isolation during COVID can affect memory? It does, it has. I've had many of my patients had very bad experience. I'm sure that the social isolation is a bad thing. And I don't know what to say other than we should all try and do what we can do to get out from under this terrible pandemic as soon as we can, as soon as it's safe. Your doctor feels it's safe for you to go and socialize, even if you're wearing a mask. I encourage you to do it, whether it's outside, whatever is safe, I encourage you to do it. Are there lifestyle changes? Well, we talked about the Mediterranean menu of foods and exercise and how important those are. So yes. What are the side effects of the memory meds? So that's a good question. So the medications like donepezil, Aricept, about 80% of people have no side effects, but the 20% who do, they can have trouble with loose stools. There can be some nausea, okay? Rarely there can be vomiting, but that's really pretty rare. And the loose stools, usually it can be managed. Usually a little bit of Imodium AD can actually manage that if that's the big problem, or sometimes just a lower dose can manage it. Some people have trouble with vivid dreams at night, but usually taking it in the morning can get rid of that side effect. And there's other tricks we have in our office if you're still having trouble with vivid dreams. And some people can have a runny nose or increased saliva, muscle aches, and rarely there's a slowing of the heart rate. But all of those problems can be managed. Does hearing loss affect memory? The answer is yes, it does. And it can, for I think the obvious reason is that if you can't hear well what people are asking you to remember, you're not going to remember it, right? If you say, go to the store and pick up these 3 things, and the person doesn't remember those 3 things, or they mishear one of them, that can cause memory problems. There are other researchers looking to see if there's other reasons that hearing loss is related to memory problems, but those have not been sorted out yet. So another question is about what happens if a person has more than one of these diseases. So the specific example is a mixture of Lewy body and Alzheimer's. And they're recommending a medication to help with the hallucinations and the dreams. Is it possible the medications will never stop the hallucinations? So let me tell you, okay, this is very common. It's very common to have both Lewy body and Alzheimer's disease. And the best medication to reduce the hallucinations, either in their frequency or their strength, is the cholinesterase inhibitors. So are the medications like donepezil, Aricept, rivastigmine, Exelon, and galantamine. Those are the first-line treatments, okay? And don't let anybody tell you otherwise. Those are the first-line treatments. And this is spelled out in detail in this book about how to manage hallucinations. The second line, okay, would be to use the Prozac family of medications, which would be medications like sertraline or Zoloft, escitalopram, or Lexapro, because that has people not be bothered by the hallucinations. And that's the next piece I wanted to mention is if someone's having hallucinations, but the hallucinations are, say, of an animal or a child or another person, and it's not threatening to the individual, I say we try not to worry about it. Let them have the hallucination. Try and redirect them to something that is more reality-based, but it's not important to eliminate the hallucination. It's important to reduce its impact, okay? Because it can be very difficult to completely eliminate hallucinations. The idea is we want to lessen their impact. So we want to use the Aricept family of medicines. Then we want to use the sertraline or the Zoloft family of medicines. We want to try to redirect the person away from the hallucinations. And very rarely we'll use a small dose of an atypical neuroleptic medication, something like risperidone, okay? Although that could cause a worsening of the Parkinsonism that often goes with Lewy bodies. It can be tricky, and obviously I recommend that you see a specialist. And I should mention that if you're a veteran, I'd be very happy to see you at the VA, where I see patients at Jamaica Plain. If you're closer to the Brockton area, we have colleagues that of mine that see individuals with dementia at the Brockton VA. And if you're not a veteran, we'd be very happy to see you in our small group practice in Newton, Massachusetts, right on the 128 and 95 border with Needham, called the Boston Center for Memory. And you can Google that, Boston Center for Memory, although it's in Newton, not in Boston. And we'd be happy to see you there. Okay, for those with dementia, could you discuss why people often recall memories from the past yet can't recall if they saw you yesterday? So this is very common, and I can explain this and tell you exactly what is going on. And I'm actually going to refer to a slide that we had before. So do people remember this slide? Okay, so we have our new memories that are made in the hippocampus and these older memories that are made in other or stored in other parts of the brain. So in Alzheimer's, we talked about how it destroys the hippocampus, but the other cortical regions, the other brain regions, they're preserved for a long time. So what happens is these older memories, they're very present. They're the only memories the person has. So this frontal lobe file clerk is standing over here by the older memories, is able to pull them out and talk about them. But because the hippocampus is damaged and new memories cannot be formed, can't remember if they saw you yesterday. So I hope that's clear. What about vascular dementia due to lack of blood flow to the brain? How to reverse that? All right, so let's talk a little bit about vascular dementia. So the first thing is that vascular dementia is rare, okay? It's not that common. So people are often told they have vascular dementia when they don't really have it, because somebody looks at the report of an MRI scan or a CAT scan and it says there's mild to moderate microangiopathic change, which is little strokes, or sometimes they call it small vessel disease. But it's very common to have small vessel disease, and it's very uncommon to have it cause memory problems. So that's the first thing, is it's rare. Okay, it's much more common to have Alzheimer's or dementia with Lewy bodies or something like that. So you'd really want to see an expert to make sure that it is really vascular dementia. But what does vascular dementia mean? So vascular dementia is dementia due to strokes. You have a stroke, you have another stroke, you have another stroke. And when you have a stroke, as the questioner correctly says, that there's a blockage of a blood vessel, and that part of the brain doesn't get enough blood. And that means it doesn't get enough oxygen and glucose. And then that part of the brain dies. Okay, bam, it's gone. And you can't get it back. It doesn't come back. So the goal with vascular dementia is to try and improve the brain function that's left. That's number one. And you want to try to prevent further strokes. Because in theory, if you can stop the strokes, you'll stop it from getting worse. Okay, so you need to see a regular neurologist to look for stroke risk factors like heart disease, carotid artery disease, that something could be done about. And sometimes you'll need to have a procedure on your heart or your arteries to fix that problem. And sometimes they'll put you on some blood thinners, or they'll put the person on some blood thinners to help prevent the strokes. And then the second thing to do is, it turns out that donepezil, Aricept, rivastigmine, Exelon, galantamine, those medicines also help vascular dementia. So that's the other approach. What do you recommend for somebody with mild cognitive impairment? Well, the first thing I recommend is the Mediterranean menu of foods. Second thing I recommend is aerobic exercise at least 30 minutes a day, 5 days a week. The third thing I recommend are the cholinesterase inhibitors. That's the donepezil, Aricept, rivastigmine, Exelon, galantamine. Those are helpful in mild cognitive impairment. So that's what I recommend. A family member has mild short-term memory problems, trouble with multiple steps, and these seem to get worse when the person is frazzled or upset. Is this a sign of some type of dementia? I can't tell just from that description, but the way I would put it is I worry that it could be the beginning of dementia. Maybe they're in that mild cognitive impairment stage, right? If their function, their day-to-day function is still normal, they can still do grocery shopping, they can still make themselves a small meal, they can still, manage their finances, pay their bills. If their function is normal, then by definition, they don't have dementia. But if they have to work a little bit harder to do all these things than they used to, that could be mild cognitive impairment. And I recommend, just like I said, jump all over mild cognitive impairment, implement those lifestyle changes, have them see somebody like me who's an expert at these things, get them started on some medications that can help. The studies show if you start them on medications, you can delay clinical presentation of dementia by 6 to 12 months. So it is absolutely worth jumping all over it. Another question is, can dementia be hereditary? It turns out half the people with dementia have a family history of it. The other half do not. So everyone is at risk for it. But if you have a family history, it does raise your own chances of having it twofold to fourfold. So if the risk of developing dementia at age 65 is 3% without a family history, with a family history, it's doubled to quadrupled. So it goes to 6 to 12%. So it is a big increase in risk, I won't kid you, but that still means you have an 88% chance of not having dementia. And there are lots of people that have a family history that never develop it. So doesn't mean you're destined to get it. Okay, so a few questions in the chat. Okay, and I think we covered this one already. What's the most effective medication to stop hallucinations in a person with moderately progressed Lewy body and Alzheimer's? And I mentioned first line is the donepezil Aricept. Second line is the sertraline Zoloft family. Third line would be risperidone. And we talked, like I said, about both pharmacologic and non-pharmacologic things in the 6 Steps books. Can untreated sleep apnea cause dementia? Absolutely. It absolutely can. It's very important to treat sleep apnea. It can, number one, disrupt sleep. And we talked about how important sleep is. Number two, it can lead to strokes. And we talked about how strokes can impair memory and some patients can get vascular dementia. It also can decrease the oxygen to the brain, even if there's not a stroke. And when you decrease the oxygen to the brain, it can damage the hippocampus directly. Remember, that's our new memory file cabinet. Okay, wow, you have been just a wonderful audience and have asked so many wonderful questions. I believe that I have answered them all, but if there are other questions, please do type them into the Q&A box, and I would be happy to answer them. And Robert, I'm okay if you want to allow people to unmute themselves and ask a question, if anybody find it easier that way.
So Dr. Budson, Rose says, I enjoyed this presentation. Thank you. That. So let's say last call for questions. If anyone wants to type a question into the Q&A, if anyone wants to ask a question via audio, I believe I am able to allow you to talk. If you'd like me to do that, you can let me know in the chat, and I'll do that for you. So we'll give it another 15 seconds or so. Thomas says, most helpful, and many thanks. Thank you, Thomas. So Dr. Budson, I don't see anyone indicating they want me to unmute them. Diane says, thank you so much. Great, valuable information. So why don't we wrap it here? And do you have any last words for the group before we end the call?
Yeah, so the last words I have are that whether the memory problems are very mild and you're just sort of not even sure, should I bother seeing someone about it? You know, should I do anything about it? You know, that's the reason we wrote this book. So if you don't want to see anyone about it, you want to sort it out yourself, check this book out of the library, and you'll be able to figure out whether or not you need to do anything or you should see a doctor or not. And if you have a loved one and you're feeling drowned and you're like, I don't know where to turn, everybody's giving me different advice, this is too overwhelming, that's why we wrote this one. And again, I encourage you to check it out of the library. And Robert, if you don't have a copy soon, I'm sure one is coming, yes?
That's right, Dr. Budson. I know that I ordered one several weeks ago. It's probably already here, but I can't say for certain.
Okay. So like I said, I encourage you to check the books out of the library, empower yourselves with knowledge, whether it's for mild memory problems or, you know, sort of, you know, full-blown dementia. there's things you can do to help yourself, to help your loved ones. So thank you, everyone, for listening tonight, and I hope this was helpful.
Yeah, well, thank you so much, Dr. Budson. Greatly appreciated. Wonderful presentation as always. I want to thank everyone who joined us live here on Zoom. And again, look for that email from me tomorrow morning with a lot of hopefully helpful information. And please take 30 to 60 seconds and fill out that feedback survey. That would be really greatly appreciated.
Yes, and I did want to say that I'm always looking for ways to improve my presentation. So, if people have suggestions or parts of the presentation that you think didn't work well or were confusing, feel free to put that information in. Robert can give me the feedback and I can do a better job next time.
All right, excellent. So thank you all so much. Thank you to the Corning Foundation. Thank you for some of the other libraries in the area that helped me promote. And we will see many of you at future programs. Thanks again, Dr. Budson. We'll do it next time you publish a book as well.
Coming out in February 2023.
There we go. All right. What a tease.
Okay.
All right. Thanks so much, all. Have a great night. Bye-bye.